I'm Dr. Tom Krummel, a pediatric surgeon by trade and chair of the Department of Surgery at Stanford. Like with most things, preparation is everything. And so if you arrive ill-prepared and ignorant of what's going on, you'll get very little out of it. If they arrive understanding what the problem is, understanding what the plan is, whether it's in the office or the operating room or any place in between, then you'll get the most out of it. These days, it's easily possible to find many videos available on the web for all kinds of things, so the prep ahead of time will make you a good observer rather than a naive observer. Again, information is ubiquitous, and so if someone hasn't read up on gallstones and is coming in to watch a cholecystectomy, I get the sense that they're apparently not that interested. It's not like it is portrayed on TV. Forget it. It is not emotional outbursts. It is not drama. Rather, it's day in, day out, people trying to solve other people's problems. In the operating room, there's frequently a concern that you're going to faint or it's going to be horrible or ugly. And I always tell our students coming in that actually it's like watching the most beautiful sunrise you've ever seen in your world. Absolutely spectacular privilege. I think that's something that we really need to focus and emphasize to our trainees, is that it is a remarkable privilege to watch healthcare happening, and so it needs to be treated as such. The patients are generous in their exposing themselves and their medical problems to observers, and that always needs to be remembered. Again, there is a certain expectation of not just decorum, but behavior and an attitude of respect that I think if that underpins the interaction, things will go well. If it looks like there's trouble, it's not a time to start asking questions, but to sort of pull back and wait for the right moment. And usually we try to have a chaperone in for starters, just to get people in the groove, and better to ask questions later rather than when it looks like that, we're in the middle of something that appears difficult. And usually that's not that hard to tell. The other people in the room can also be incredibly helpful. So while there's often a tendency to focus on the docs, the nurses are there, are incredibly helpful to us, the scrub techs, the anesthesiologists, the other trainees that may be students or residents are great sources of information. Seeing the same case with a different surgeon, seeing the same surgeon do the same case can be very helpful. Sometimes the insight, because you don't really know what you're looking at, is missed. Ride in the back of an ambulance, spend a Saturday night in the emergency room, go to labor and delivery, watch how the attendants park the cars. It gives you a deeper appreciation for the workflow, and you'd be surprised what an open mind will do. The unique opportunity is to watch not only what is done and what is said, but what isn't said. If it looks like something's difficult, the surgeon may not say it is, but that's an important observation about maybe there's a better or an easier way. Make it really good quality time, and by that I mean, there are a million distractions and we all got iPhones and things to mess around with or to be distracted by, but if you bring a real prepared mind, I know what's going to happen, I'm watching what's happening, a couple of key questions at the beginning and at the end, will make the most out of the time.